Welcome. We're going to go ahead and jump right on into today's lesson for the most commonly utilized mental and behavioral health CPT or current procedure terminology codes. First, let's take a look at 90832. 90832 represents 30 minutes of therapy. In this service, the provider performs psychotherapy, a series of techniques for treating the psychiatric disorders of the patient. The treatment session with the patient typically lasts for anywhere between 16 to 37 minutes. And I do want to highlight that that does include documentation time. Let's take a look at the next one. 90833, therapy with an E&M, medical. Typically, 90833 is an add-on code for one who might be performing psychiatric services and billing an evaluation and management code. For example, a 99214 or a 99204 or something of that nature, you will be able to append a 90833. This is not for therapy to stand alone. This must be built with an E&M code as it is an add-on code. In this add-on service, the provider performs psychotherapy, a series of techniques for treating psychiatric disorders of the patient, in addition to an evaluation and management services in the same session. So that part is important. In addition to an evaluation and management service in the same session. The treatment session with the patient typically lasts anywhere from 16 to 37 minutes. Let's take a look at the next one. 908 or 90834. That represents 45 minutes of therapy typically. And in the utilization of this CPT code for this service, the provider is going to perform psychotherapy, a series of techniques for treating the psychiatric disorders of the patient. The treatment session with the patient typically lasts for anywhere between 38 and 52 minutes. So again, be reminded that clinical documentation time is included in the billable time for the 90834 CPT code. And this is a time-based code, meaning you utilize this to represent time spent with the patient as well as for clinical documentation. Let's move on to another typically or commonly utilized CPT code, 90836, which is a therapy with other. In this add-on service, so again, an add-on service is typically something that's appended alongside an E&M or an evaluation and management service. The provider performs psychotherapy, a series of techniques for treating the psychiatric disorders of the patient, in addition to an evaluation and management service in the same session. So that part is important. It's not only in addition to the E&M, it has to be within the same session. This add-on code represents time that lasts anywhere from 38 to 52 minutes. Again, that also includes clinical documentation time. Next code. So this is actually the most popular mental health billing or CPT code, the 90837. This represents 60 minutes of therapy. And in this service, the provider performs psychotherapy, a series of techniques for treating the psychiatric disorders of the patient. The treatment session typically lasts for a minimum of 53 minutes or more. So let's importantly note here, minimum. So though typically this is billed for 60 minutes, the minimum documentation requirement for compliance is actually 53 minutes or more, and that does include clinical documentation time as well. (90839) crisis therapy. In this service, the provider performs psychotherapy for a crisis situation when the patient is in a life-threatening state and needs immediate attention. The treatment session typically lasts anywhere between 30 to 74 minutes. So as you can see, the time spent gap for this one is significantly larger than some of the other time codes. For crisis therapy, the 90839, we will be using this for any time spent with the patient, 30 to 74 minutes. There is an additional add-on code that comes along with that, which is the 90840. In this add-on service, after initial psychotherapy intervention for crisis, so after the 90839 is utilized, the provider performs an additional 30 minutes of psychotherapy for crisis. The crisis state is a life-threatening conditioning requiring immediate attention to the patient. So what this is telling us for compliance, the crisis state is life-threatening and the patient is requiring immediate attention. But also, let's make sure that we note for the 90840 or the 90840, this is an add-on for an additional 30 minutes. So this comes after the 90839. So pretty much once you hit 75 minutes, you're able to bill the 90840 once you utilize an additional 30 minutes. Okay. 90833. This is also a therapy add-on. So this is typically used in combination with psychiatric services. So you will bill an E&M code in addition to the 90833. Let's take a look at the description. In this add-on service, the provider performs psychotherapy, a series of techniques for treating the psychiatric disorders of the patient, in addition to an evaluation and management service in the same session. The treatment session with the patient typically lasts anywhere between 16 and 37 minutes. So 16 and 37 minutes is the time requirement for the 90833. And remember, this is an add-on service, okay? So this is for psychiatric services. So a psychiatric provider typically performs psychotherapy services in combination with an E&M code because this is an add-on. So evaluation and management services should be provided within the same session for the same data service, in addition to the 16 to 37 minutes of psychotherapy in order to utilize the 90833. Let's take a look at the 90847. So for providers, especially with the nature of like licensed marriage and family therapists, but also for normal psychotherapists, you run into family sessions, couple sessions all the time. The 90847 is utilized for family therapy. Now, in the description of this code, a provider meets with the patient's family with the patient present. That part is really, really important. With the patient present to counsel the family on the psychological issues affecting the patient and the family. The provider supplies psychotherapy to the patient and his family when individual psychotherapy sessions are not sufficient. This is done to evaluate the treatment plan and role of family members in treatment. So again, the provider supplies psychotherapy to the patient and his family. So this is couples, this is mother-daughter, this is father-son. Anytime there's a familial connection, there's more than one person, you're going to utilize this particular CPT code as long as the patient is present. All right. And we wanted to make sure we highlight that because there is another commonly utilized CPT code, the 90846, and that is for without the patient present. That's obviously much less commonly utilized than the 90847, so I did not enter it here today. But the 90846 is for without the patient present. If you found this to be informative, please be sure to leave a like, subscribe, and watch out for more as behavioral billing aims to educate all for mental and behavioral health coding, billing, and revenue cycle management, alongside the software processes that makes it all more efficient.